Ah!
What's that?
You see that? What is it?
That's a papillomavirus.
A what?
A papillomavirus.
What's that?
It's a virus,
responsible for cervical cancer.
but not only.
Also for vaginal cancer.
Penile cancer?
Anal cancer,
or throat cancer in men and women.
it's a common virus.
And it's contagious.
Usually, it is transmitted by sexual contact and can take different forms. 20 to 25% of women carry it in French Guiana. But beware, carrying a papillomavirus does not mean you have cervical cancer. Most often, the cervix defends itself and evacuates the virus within a few months, but sometimes it remains. That is when it can modify the cervix and lead to cancer.
So how can we protect ourselves from that? Papillomavirus.
You can get vaccinated
Against the most aggressive papillomaviruses. The vaccination is geared towards girls, starting at 11 years old, as well as for men under 26 having sexual relations with men. The protection is more efficient if the vaccination is done before the very first sexual intercourse. And of course, you must use condoms, even if the condom is not 100% foolproof, as the virus is transmitted skin to skin. At the end of the day, screening should be done regularly and it is reimbursed by Social Security. All women from 20 to 65 years old, menopausal or not, sexually active or not, must get tested.
And how is it done?
After a general examination,
The doctor or midwife does a cervical vaginal smear test. What's that?
it consists of rubbing the cervix
With a little brush.
It's a bit unpleasant.
But it's quick and painless.
And if the floating is not normal?
a deeper examination is done.
And if a precancerous illness is found,
A small operation is done.
Without removing the uterus?
Without removing the uterus.
Where do we go for this?
If you don't have Social Security, you can have it done for free at the Red Cross centers, at Cayenne's Family Planning Center, in the PMIs of Saint-Laurent, Kourou, Cayenne, Rémière-Montjoly and Matoury. If you have Social Security, you can go to a medical examination laboratory or see a gynecologist, an independent midwife or a doctor. If you live in an isolated city, the health centers and the PMIs will help you.
the smear can prevent
90% of cervical cancers.
So do not hesitate.
Let's vaccinate our children and let's get tested.